we've been covering healthcare and just being health and beauty, just the whole conversation of it via Brooklyn Beauty Television, BBTV, and all-inclusive Made in Brooklyn TV network. And it's about staying healthy as we move forward. If you don't have health care, we got to look at your other alternative. And I think eating healthy is the #1 step for remaining healthy. I mean, I know that was a lot, but can you break that down a little bit in the interpretation of what I just
Well, a Mediterranean diet is something that's been talked about a lot. Mediterranean diet is high in protein, but not and vegetables, and a little wine, a little pasta. Can't hurt. But you got to be careful. Everything in moderation. But the salad that we have with our pasta tonight, for example, is filled with great things: carrots, raw cucumber, arugula. So it's got some bitter greens in there as well as regular mix of lettuces, which all is good for you. And a little glass of wine can't hurt. And that's the Mediterranean diet. And, organic food, everything's organic that we eat.
Well, yeah. And I assume that organic, you can get it, if it's available. And if it's not, then there's an alternative of, making sure that your food is boiled or definitely boiled or cleansed before using. But, moving forward into this whole discussion of the #1 topic, healthcare, it shouldn't be a whole conversation about it. I mean, it shouldn't be a big topic. I mean, this is healthcare for all.
Well, America is one of the only industrial countries that doesn't have a national health service or free health care for everybody. We have a mix. We have Medicare, we have Medicaid, and we have private insurance. But we're moving more and more towards more public options for people. I think a nice compromise between Medicare for all is a public option for picking a health insurer that will provide the services you need. And you need mental health, you need maternity care, you need planned family planning. All those things need to be part of your insurance package.
I see. Now, I mean, it's been so many years. I mean, why hasn't a system been in place? I mean, there's millions of people, millions of dollars that this can be situated. The system can be built.
Because we've grown up on employer-based health insurance, where the employer gets their health insurance from a private company, which then gives it to their employees.
So you're saying now that we have more independent folks that are working for themselves and more small business owners, so therefore the coverage,
And for folks that don't get good health insurance from their employer or who aren't employed, right. You need health insurance options.
I see. Listen, everybody, tune back to our podcast here. We're coming to you live from Brooklyn, New York, and the conversation continues, is healthcare. We have invited all the candidates in New York City to be interviewed on the show so we can talk a little bit more about it, get more educated about this healthcare and how it is something that we need to be more educated on and be more informed.
So we talked about health insurance today. Next time we'll talk about healthcare access, because just because you have insurance doesn't mean there's a doctor or a nurse available to take care of you. So we'll talk about that next time.
Okay. All right. Listen, everybody, you heard it here first on Brooklyn Beauty Television, BBTV podcast, an all-inclusive Made in Brooklyn TV network, and we're bringing you the beauty of Brooklyn with information that it will be helpful for you and for all. All right, everybody. Till then, I'm signing off. You know what I love to say? Till then, stay in Brooklyn. You count, you matter. We'll see you in the next podcast. Bye-bye.